This lesson covers patient advocates and their role as guides in the healthcare system. You'll learn about the principles of advocacy, common tasks conducted by patient advocates, skills of effective advocates, and the patient-advocate relationship. At the end, we'll talk a bit about HHP's free peer-led patient advocacy workshops program, Understanding and Accessing the Healthcare System. First, you might be wondering, what is a patient advocate? A patient advocate is an independent, neutral party that helps their clients navigate the healthcare system. Patient advocates educate patients about their rights and represent the patient's interests. They promote patient autonomy and empowerment while helping patients understand their healthcare options. Patient advocates help to match healthcare services to their patients' needs, resulting in greater healthcare access for their patients. Patient advocates do a lot. Their job tasks depend on what their client needs. They may help patients communicate with doctors and other healthcare professionals to ensure they have all the information needed to make healthcare decisions. At other times, patient advocates may help schedule medical visits or tests. They may assist in filling out medical forms or paperwork. Sometimes, patient advocates might help research available healthcare services like transportation or home health aids. In general, patient advocates seek out information that will assist the patient in making their own healthcare decisions. Patient advocates don't need specialized medical training to be effective. However, they should have a thorough knowledge of how their local healthcare system works. This includes how to access healthcare, insurance options, and all resources available. Advocates need to be able to navigate bureaucracy to prioritize the needs of their clients. Patient advocates should be able to read and sort diverse information and translate that information into easy-to-understand terms. Effective patient advocates should be empathetic, compassionate, committed, and have excellent communication and problem-solving skills. It's crucial that patient advocates are good, attentive listeners who ask follow-up questions to understand their clients' needs. Patient advocates follow the basic principles of advocacy. They should always act in the client's best interest in accordance with their wishes and instructions. This means that the patient advocate needs to keep the client informed and act impartial when offering honest, independent healthcare options. Patient advocates should carry out the instructions of their clients with diligence and competence. It's important that patient advocates maintain client confidentiality and don't share personal health information with people outside of their client's healthcare team. Patient advocates are an integral part of a healthcare team. They serve as a voice for the patient. Advocates should be an active partner and ask lots of questions to understand the patient's needs and desired outcomes. Advocates should work with their patients and clients to identify where support is needed to navigate and access the healthcare system. It's important that patient advocates build trust and strong relationships with their clients. This can be done by focusing on good, open communication and setting clear expectations and timeframes for updates, meetings, and care. Above all else, a patient advocate should respect the voice and wishes of their client. Patient advocates have a responsibility to continue their education and broaden their knowledge of advocacy work. They need to stay up to date on all regulations and resources available to patients locally. They should pursue opportunities to advance their education and learning. These may be traditional continuing education classes. Other times, patient advocates may share knowledge with other advocates, develop their communication skills, or stay up to date with information and research related to their clients' health situations and diagnoses. At HHP, we focus on peer-led patient advocacy in our free workshop program, Understanding and Accessing the Healthcare System. Peer-led advocacy is when individuals with shared life experiences advocate for one another. These life experiences may include similar backgrounds, demographics, diagnoses, or health issues. The program improves health literacy and prepares participants to act as patient advocates for themselves, their loved ones, or for peers. The free online Zoom workshops are 1 hour long and cover essential topics including understanding health language, health literacy, knowing your patient rights, how to stand up and be heard, and how to research online as an e-patient. There are also location-specific workshops like learning the health coverage and insurance you're entitled to and how to sign up and renew it, and where to get help for specific locations, states, and countries. Upon completion of the patient advocacy workshop, patients receive comprehensive follow-up support from HHP. This support includes dedicated support communication channels, follow-up newsletters containing workshop materials and answers to questions, monthly newsletters to keep participants informed, train the trainer workshops where select individuals are trained to give the workshops to their own local communities, HHP patient education video courses, the HHP online peer-to-peer panel events, and HHP real-world data. HHP's mission is to improve the health of the underserved and vulnerable through holistic information, education, and advocacy. To learn more about our patient advocacy program, including how you can become a patient advocate for yourself or a loved one, head over to our patient advocacy page.